Wonderful. Thank you all for attending the CSI panel event here in January, which is some date. I believe it's the 21st this evening. I am Marcy Smaha, the chapter president, and leadership team is very grateful for all who are attending. And we want to put out a big thank you to Dr. Gene James, who is our presenter this evening. He will be speaking on motivational interviewing, as well as a new model that he is developing and tweaking, and it is built to help those folks who are kind of past that pre-contemplation stage and have made that decision, but are beginning to realize they're on that edge of like, oh boy, there's consequences from my choices. What's going to happen next? So very excited to hear what Dr. James has to say this evening. Now, he has requested that we keep this very informal and have questions as we go. And so to help his presentation run smoothly, as well as have those questions pop up, here's how this is going to work. I'm going to ask that y'all please mute yourselves. I will keep my microphone open. And if you would please chat me your questions personally. So not just to everybody, so that it doesn't just keep popping up the chat bubbles over everybody, but just chat them to me. And then I will intervene and ask Dr. James the questions as they come in. All right. And so without further ado, Gene, thank you again so much for coming tonight.
Okay, would you allow me to share my screen?
Absolutely. Go ahead and try. I think
Okay.
I gave you permission.
Oh, you did, okay. Okay, if I have, I just want to do kind of an intro here before we get into, I actually prepared a PowerPoint. And tonight's presentation is really more of a survey of motivational interviewing. It's not necessarily providing you a ton of techniques or case studies. What we're going to talk about tonight is what is motivational interviewing, what it's not. There's a lot of confusion out there in the field about MI in the context of what it is. And the authors of Wolnick and a bunch of different authors put together 10 different things that motivational interviewing is not. And I'm going to speak to a few of them. I will ask Ryan, Dr. Melton, if I could just put a folder on the CMHC program page that I can put a lot of resources for motivational interviewing that go much deeper than I will. So tonight's presentation is really going to be that survey, like just discussing some of the principles of motivational interviewing, some of the assumptions of motivational interviewing. So we're going to go through all of that process. I'm going to introduce a model tonight. Some of you, I see faces that I've worked with. You're going to hear some of the stuff. It'll be somewhat redundant, but however, I've added to it an extended process that will incorporate some motivational interviewing interventions that will help your client process once a decision is made. Motivational interviewing is about contemplation to finally maintenance. And so the model that I'm going to present tonight is not motivational interviewing. The purest motivation MI clinician would give me some really dirty looks if I tried to say it was motivational interviewing. It is not, but it does incorporate some of those things. And having said that, it's really important that you understand that when you hear what's going to be presented tonight or from other clinicians or other faculty, that it's really important that you create your own version of what you're learning and then demonstrate that in session. Because in session, things are fluid. Humans are multidimensional, past, present, future. The identity issues of who I am sitting across from you as a client in your session, from what perspective am I approaching my it, if you will? Is it being a father? Is it being a student? Is it being a worker? So it's up to you, clinician, to really get that funnel. It starts out very wide, to narrow it in the context of motivational interviewing. That is part of the process of motivational interviewing. How does culture impact decision making? Because motivational interviewing is a decision making model. So can I treat everyone that comes into the room with a standardized way of decision making? That's part of the process of you recognizing who is my client, what is their process, and I'm going to provide you some information tonight that might help you discover what that is. So I'm going to start off, I'll share my screen now, and we'll go into, I'm going to keep this fairly brief. It's not going to be real extensive. Okay. Okay, this is the slides. Okay, motivational interviewing is really a facilitation. It's an informed decision-making process model, which means it's not a theory, it's not a technique. There's no standardized way to approach motivational interviewing that I can record. Yes.
Would you be willing to make it big? If you know what I mean, go to the slideshow from beginning. Yes.
Where am I at? Oh yeah.
I think. Does that do it?
There, how's that?
Perfect. Thank you.
Sorry about that. Didn't think about it. I could see it, and that's what mattered, right? Okay, so I really want to talk about that what motivational interviewing is. It's a collaboration. It's not client-centered per se. In this model of motivational interviewing, you're going to collaborate and work with, and sometimes be more directive than probably what you're used to, in the context of facilitating a process to help your client find out whether or not the goal that they've established is accurate, is important, and is there a confidence level to follow through. And that's your role, clinician, is to facilitate that process, which includes some directive interventions that some of you may or may not be used to. MI incorporates assumptions, so we're going to talk about those. It incorporates specific principles. Now, motivational interviewing can be very linear depending on your client's process. So a client can go through that pre-contemplation, et cetera, go all the way through those to the point where they've established a concrete plan to complete their goal, to complete their decision, if you will, about what it is they want. On the other hand, there are some clients that ambivalence reoccurs in that process of establishing a concrete goal, because there are other elements. Remember, humans not only are multidimensional, the identity issues, there's cultural components, but also there is this process where ambivalence, once those layers come off, can reoccur. And so what we're going to talk about tonight is going to be how you can discover if that ambivalence still occurs once a decision is made, before they actually implement and go out and do the goal that they decided that they want. So it, again, not necessarily linear, and it can be cyclic, where you go back and you reassess, and you go back through some of those earlier interventions to determine the confidence level of your client. So MI is really important when ambivalence is high. I don't think there's anybody in this room that doesn't understand ambivalence. Is there any issues with, before I move forward, what ambivalence is? Okay. Now, this comes off literature, and I've got a nice resource list. I took, some of these are direct quotes, while most of them are out of literature. And this is one of the ones I kind of disagree with. Ambivalence is high, I agree with that, but people are stuck in mixed feelings about change. I don't necessarily agree that it's just about feelings. It's just not about the emotive level or place that your client is at. And so the model I'm going to talk about later is a 4D model, the four domains of human process. And that's we think, we feel, the emotive side, we act out, called behavior, and then we make meaning of it. And so if a person is experiencing some thought distortions, etc., where the thinking is messed up, it could be that their thought process has created emotive places where they have difficulty making a decision or change. So that's one of the ones I would want to enhance a little bit. If I was actually teaching this course and have you demonstrate, if you were in that class, kind of working through to determine whether or not your client is in that stuck place emotively, cognitively, or behaviorally. And so those three elements, I think, should be incorporated in this first point. And second, it's useful when confidence is low. That three should, I see I messed up there. Confidence low. And confidence level is really important. Doubt occurs when the confidence level is low, which creates a place of ambivalence. Now, confidence can be low for a lot of different reasons. And so you as a clinician, I'm thinking about self-esteem issues. I'm thinking about if a person has actually experienced trauma in their background that creates this confidence level and creates a fear-based model. Is the client wondering or whether or not family, depending on the culture they come from, will respect their decision? Will they respect their family if they make that decision? And so we've had some Korean, Chinese natives come into your counseling ecology, some of you, and this is part of that process where this collectivist version is and can be different than the individualistic dominant society. So this confidence level has a lot of different elements that it's up to you, clinician, to be able to go through that process to make that determination and help your client recognize that confidence really when it comes to autonomy, and that's that, or finding your, what I call your authentic self. In this authentic self, can I bring my confidence level up after I process through all of the barriers or the people in place that would create doubt in my mind or lower my confidence? So that's part of that process of MI. Desire. And when a client comes into your counseling ecology, remember the funnel is big. All of this data, you are scientists, you're collecting data. Everything you do in that counseling ecology is an intervention, everything. But in that process, if you push your client too quickly for a decision-making place and their desire is low, are they committed to it? Is it important? If there's no buy-in, it's not going to work. Some of you have probably tried interventions, maybe homework for clients, and they come back and say, well, I just didn't get to it. There was no buy-in, likely. And that's the same thing with MI. It's your role as a clinician to really move your client to a place to facilitate a process that really elevates the desire to change, commitment to change, if you will. So what are the, and we'll talk about that too, what in the model that I'm going to present, and we'll talk about some of the benefits of moving towards your goal, the benefits of moving away from your goal. Some of you have already experienced that model working with me. So how will that, I don't know about you, but I know in my lifetime when change occurs, it can really be difficult. What you're asking of your client is to change. So one of the things about MI, it is not an easy process, especially for your client. So you clinician, as you bring that funnel down, that's your objective, is to bring that funnel down to determine the importance and the benefits. But that must be decided by your client. You cannot coerce a client into making a decision. Even if your conceptualization has determined, if my client would just do this, they would get their act together. That's called a conceptualization. But your client, you have to facilitate a process where you either validate or invalidate your conceptualization and move your client to a place where the importance of the change is beneficial and proactive. So that's the process that MI, when it can be useful. Okay, I got what MI is not, and this is I'm going to go off literature here because this whole presentation is pretty much based in what literature is talking about. Okay, does anybody know what the trans-theoretical model is? Okay, back in the 80s, they designed this they called it the trans-theoretical model, or TTM. And in this, what it was really helpful, and actually MI kind of built off of TTM. Uh, it was really unique at the time because what they recognized, especially in the addictions world, that people were not committed to change. And so clinicians were just busting their hump trying to get people to help them change, and there was no commitment to change. And so what would happen is not only would the client get frustrated and discouraged, but so would clinicians when they tried to implement this model by trying to coerce, trying to talk people into change. That's what the trans-theoretical model looks like. That's a trans-theoretical model of change. MI is not that. MI creates a process that's led by the clinician that allows a client to go into those places of authentic self, to really discover what the change is, why it's important, are they committed, and what are the consequences of that decision-making process. So it is a process. It's not a theory. It's not a technique. That's right to my next one. A technique kind of suggests kind of a simple operation, a particular procedure that I can do every time. That I can do ABC. A technique can be very linear. MI, on the other hand, is goes back to that process work. In other words, a technique, if you see somebody do it, I can teach it, and I can do the same thing every time. And that is not MI. MI, which is really fascinating, they call it the spirit of MI, which to me goes to that very existential place of meaning. A technique kind of stays in kind of that linear place where the specific outcome, the expectation is that outcome, or the assumption is based on your process or your technique that has that specific outcome. Those are elements of MI, but MI has a process that moves in the spirit of MI, which makes it unique, makes it different.
Dr. James, can I ask a question?
Yeah.
I was thinking, like, I have a lot of clients with PTSD, and I'm wondering, like, is this even something that could apply to them? Or I think what I'm really wanting is like interventions. And I don't know if I'm the only one, but I was just, can this apply to PTSD and like trauma? Or is it only like mainly high functioning clients.
This is not necessary. Fact is, most people that come in where you're going to implement an MI model aren't necessarily high functioning at all. However, MI believes that the answer lies within the client.
Right, a humanistic kind of approach. Yeah.
It has that element, but it's not a client-centered approach. So what you're talking about is the right place to go implementing an MI model where you would use a more directive approach on establishing a goal, especially if the funnel is too big. Your role is to narrow that funnel to really identify a goal that's doable, that's measurable, and the client is committed to accomplishing it. So that's part of the process. I'm not sure.
Wonder if they can establish a goal.
Well, then you have to go back and do some more process work, because if a client is not ready to establish a goal, then what else is going on? That's my question right now. If I was working with a client that really, what are some of the barriers? What is the struggle about moving towards really being able to establish a goal? What is, is it their motive place they're in that they can't move? Is it thought distortions or their thinking that's flawed? Is it trauma in the background where they have PTSD? So part of a goal, even working with someone that's experiencing PTSD, is one, to recognize it's PTSD, recognize what triggers it. So when you recognize what triggers it, a goal could certainly be to establish a model, a goal, if you will, to really be able to remedy that with a strategic plan to really bring yourself back to a more stable place. So that's a simple goal. But out of that goal, because it's layers, you can actually work with your client to really identify a trigger. When that trigger occurs, what needs to happen? How would that be different than you're experiencing it now? What is it you want to do when that happens to bring yourself back to that place? Have you ever experienced being able to bring yourself back down to a more stable place when it's happened before? So really, and we're going to go into more, that MI is really a strength-based model. It's really encouraging your client to move forward with the skill sets that they already have. So that's part of the process. But goals, remember, goals can be layers. Your diagnosis may not change, PTSD and anything else attached with that. Your goals, on the other hand, as they process and they complete a goal, it's very likely those layers have come off to where there's something deeper and maybe more sinister or dark that a client can work through. It's about working through, it's not about getting over. And that's what MI allows you to do. MI is not, I'll go to number 6, it's not a panacea. It doesn't fix everything. But on the other hand, setting goals and being able to measure those goals, and we'll talk about that too, for your client, once they start talking, you can start out your interventions by asking, you're going through all this stuff and it's really hard for you to set a goal. So when you experience those times when it gets really hard, what would success be versus where you were at? What you just reframe asking that intervention, what would a goal be? And so you can facilitate that process to where they can actually develop a concrete goal based on what they want. Because that's what a goal is. This is what I want that I'm not doing. So it's part of the process. But Michaela, MI requires patience. And so one, you can be gentle. You can, now the MI really incorporates the art of counseling, because it must be a very gentle approach, but you're also holding your client accountable for his or her own stuff. And they have a goal. Here's what I believe when a client comes in is experiencing PTSD, and when they go into those places that gets really ugly, they want something different than that. That's your beginning place to establish that goal. That's the big funnel. What needs to be different? If you could change it, what would you like? What do you want? And so that would be part of my process. Decisional balance. I've got a really nice article that will describe all of these really at a much deeper level. What MI is on all of these, it's not cognitive behavioral. It's not a thinking process that changes behavior, although it could be. Part of those interventions are important. It's not decisional balance where I actually look at the decisional balance as a model where a client goes in and assesses the benefits and it's like kind of what I'm going to present similar later on deciding what the benefits are moving forward with that goal or to make that change versus what are some of the negative aspects of it. So that's kind of how I developed the model. I'm doing decisional balance is an older model. It goes clear back into the 70s and it kind of went by the wayside. But I really like some of the elements of it and created my own version of it that will incorporate the model I want to present. Assessment feedback, MI doesn't need assessment feedback. Many people like numbers. And numbers are useful. I like numbers. And part of MI uses numbers to assess the confidence level. But does it need feedback? Absolutely not. Feedback or assessment numbers, they're indicators. They may not tell the whole story, but they're useful. So, but MI can operate without assessment feedback. It's not cognitive behavior, it's not client-centered, and it's not a panacea. It's not an end-all by any means. Because just like Michaela was talking about, there are some things that come before decision-making. There's a process that needs to occur before a decision can actually be worked through. So it does require patience. I'm going to introduce this, what I call the 4 domains of the human process model, or 4D model. Humans think, we feel, we act out, and we make meaning. And so you're going to see how I integrate this into this, and you'll hear more about this. But those are the 4 domains that humans, most every client that you have walking into your counseling ecology, operate in those 4 domains. Now there's around 300 theories that we have in the field now. Every single one of them fit under, or subset, fit under those 4 domains. So I incorporate those 4 domains in a very simple way. Simple is not simplistic. It can be very complex. It's not a linear model. It's very cyclic. So you'll be hearing more about this. So when we integrate that, it affects how people change. And we talked about culture. We talked about identity. We talked about the past, the present, and the future, and how that impacts individuals. It impacts how you change. And so I am postulating that this 4D model, when you integrate that into a session, when you recognize that your client is coming from a specific domain in their process when it comes to their it, whether they're operating that emotive domain or that cognitive domain, or what they're doing is creating stress and anxiety. That's certainly in the addictions world. If you can speak in the context and with intentionality, create interventions within the context of where your client is operating, I'm postulating that it will enhance a therapeutic alliance. So the 4D model can be integrated into a pre and post decision-making session. We're going to talk about that post decision-making session once we get done with this. How am I doing for time, Marcy? I don't have.
It's 7:34, but we always kind of give a couple hours. So you're doing great, Gene.
Okay, well, I don't want to keep you guys forever. So some of you have heard some of this stuff, processing the process. What that means is when you observe something, especially nonverbals, nonverbals are going to tell you a story that the narrative may not. Or if you're curious and you recognize that your client is starting to stream, most of you have experienced a client that will just talk and talk and talk and talk and talk and talk and talk, and they won't let you in. So when you recognize my processing the process often begins with this intervention. Something just happened. And the same with the MI model, when that person is in that pre-contemplation or contemplation stage where they have these mini epiphanies. Yeah, I need to change. I just don't know how. And so often what I do when I call that processing the process, when you're thinking about that, what happened? What else? Because all of those really brief interventions, what you're seeing are the layers come off when you require your client to go deeper. It slows the process down and it requires patience. In that process, where you're processing the process, when you're starting to see your client make movement, it's really important for you to bring your client in recognition. This compare and contrast intervention is so validating. You know, I noticed when you were struggling here that there was a lot of stuff going on, and now you're able to really kind of do some work here, and you're starting to create some goals that will really change your life. What's different now for you? It's that existential compare and contrast of, you know, what did you learn in this process? And it's really important to use that compare and contrast on where your client was to where he or she is at. And what they do is they take all of that data, all of their narrative, all of that internal work, because MI is an internal process. It's not an external process, what you do when you assess with numbers. Numbers are all external. This is an internal process. And it's really important for you, clinician, to really look at that strength-based model where your client recognizes the movement they made and what's different now. Now, that can also be confrontation when you recognize that your client is relapsing, which is part of the motivational interviewing model, is confrontation. Something's happening now. It seems like you're really struggling with some of the places that you've been. What's happening? And that's just, you know, what's happening. You're asking the what, not the why. The client needs to answer that question. Now, you can be really intentional with those 4 domains if your client is really a thinker. You know, this confrontation, you know, it seems like something's going on up here. What's happening? What are some of the thoughts going through your mind right now? Or if it's emotive, of course, you utilize some emotive intervention. You know, or if you see your client starting to fidget or kind of really be uncomfortable, I see something's happening here. You're doing something different now in session. What's happening? So that's part of the processing. The process. There's a lot more to that. I've actually have an article written that'll go into this much deeper that I'm going to submit for publication. So motivation can grow. Motivation is not necessarily intrinsic, that I'm highly motivated about change. So in this process to really assess motivation, values matter. And frankly, values that most of your clients come in are going to be different than yours. And that matters. So the values have to do with family, can have to do with spirituality, can have to do with sexual identity. It can have to do with all the different social aspects of being human in our culture. And so those values are very important to process with your client. When it comes to motivation, how is this change going to impact the values that you've identified? That's really an important process work in motivational interviewing, to go through this thing. So you can see motivation, MI, is just not a simple process that can be done necessarily in one session. This is a process. And so determining, identifying the importance of the values of your client, and how that change will impact those values is going to be a really an important component of part of this MI process. The importance, of course, has to do on many levels. The importance on how is it going to help this client become more proactive in their life? How is this change going to bring that client to their more authentic self, on who they truly want to be? And so, of course, the confidence, there's some nice rulers out there. It's just a measurement on a scale of 1 to 10. I got a copy of one of those, but there are many ways to assess confidence. And that's a really important component of kind of that final process of MI interventions.
Jean,
Yes.
Rebecca has a question about what is the best way to challenge a value when that value is causing client distress?
Do you have an example?
Sure. My client is experiencing a lot of distress in I'll call it an addiction that maybe only a certain culture would find to be an issue. And so the client is not sure if this is a shared value, but it's a value he's been taught in his culture, but it's causing him extreme distress.
Okay, this is something, bring this back to our attention when I go into this post-decision making place, because it sounds like this person has already gone from the pre-contemplation to the contemplation to recognize that there's a value here that's kind of interfering with who I am in that existential meaning of what that value has done to him personally. And so we'll go through that process because there are impacts, there are consequences to decisions, whether I choose to move away from what he is doing versus doing what he's doing. And that's really an intrapersonal process. It's not it's intra, where this person has to make that decision about what it means to him, that existential place of meaning making on what's happening for him when he's struggling through this. If there's ambivalence, you're going to really allow him to ambivalence is very human, to really go through a process of decision making because of the impact and the consequences of every decision he made. So it's part of the process is really helping him better understand what it means if he moves this way or that way. It's a very dichotomous model in the context of his own mental health or even his self-care, where he's moving into this place where he's very uncomfortable having to go through this process. And so once you get to that place where he's able to have that discussion of the direction that he really truly wants to choose, then you can talk about strategies on how to implement that decision. So that's and then the maintenance of that decision when he gets pushback from other family members, because decisions change doesn't just affect the individual, it affects the whole tribe, if you will.
Yes.
So those are some of the discussions that you can have with this person about the impact and the consequences of that decision. And what are some of the barriers of him moving forward to the decision is made? What are some of the challenges for him personally? So what's happening for you now in this processing the process? So as you're going through this process, right, what's happening for you right now? You know, that's a really great time to process that process when you see your client is struggling, you know. And then when he does make progress towards a decision, then I go into that compare and contrast. So you were here, you were struggling in this, and you're here now. What's different? You know, so that he can validate his decision. So which might trigger more a lack of confidence, or it might enhance the confidence level. So that's part of the process of that MI model.
Okay. Thank you.
And so there's 4 fundamental processes that involved in MI. Engaging, of course, is fundamental on working with the client. Remember, this is my bent. I believe that healing occurs in the process, but it's also called talk therapy. Early on, there's going to be a lot of talk, engagement, because that client's coming in and testing you to see if that you're a person that they can trust. And so engaging with that client, in my opinion, is really enhanced when you look at and listen to and observe their nonverbals in their process as they move more towards the deeper levels. Now, in MI, engaging is really a strength-based approach. It's affirmation of strengths that you can identify. You're hearing, because oftentimes a client will come in, they don't recognize that that's a strength. It's just kind of what I do. But as a clinician, you can affirm the strengths that you're observing. They have to be authentic. They can't be fake. And they have to be in in real time when you observe that strength, or you can go back and you can report to your client an observation that you've made that's become thematic over time. That you see this client's work and the strength that they have moving forward, and the courage, frankly, that it has moving towards change. And so engaging has to do with creating and building that therapeutic alliance. It begins with talk, then moves to the therapy, which I believe happens in the process. And engaging is all about the therapeutic alliance. Do you know that your theoretical approach, your techniques, or any approach or subset of that approach has about 1% to do with your client's success? Most of it lies in the therapeutic alliance. And that's part of my research that I've done early. I've got a whole litany of research that will speak to that. Your theoretical orientation, in fact, there is one author that talked about the theoretical orientation, that people that are purists often have less education and less experience than those that have kind of this more process model. So yes, there's going to be some changes in our field, especially in institutions and hospitals, where they're going to require you to assess everything and put numbers on everything so they can get paid. But that's an institutional option. That's required of those big institutions like the hospital across from us or the mental health hospital. They're not working with process folks necessarily, even though process can occur. They're working with clients that are severely mentally ill. And so numbers matter there. They're much more important than they do with clients that walk in off the street for you. So focusing, and that's what I mean. And like in my metaphor for that is just a big funnel. The data that you collect, it's your responsibility to bring that and help your client narrow that funnel to focus. Because what happens so often when a client comes in and what they want is not happening because they don't know how to get there, because there's so much information that they have, life experiences have creating barriers for them to really move forward, or the confidence level has been destroyed based on even words, or they've tried it once and it didn't work. I'm not going to be heard anymore because of what happened then. And so many things close clients off to really being able to focus on what needs to change and how to get there. And so focus is really an important part of that fundamental processes of MI. Evoking is another part of the languaging of MI. And this author talks about evoking as being a very gentle exploration that helps your client build the why. Your job is not to create the why the client changes. That's manipulation. That's coercion. So your role is to help your client find the why I need to change. That's evoking. Uh, and then of course, the final one is planning. So the client discovers the why, and MI believes that the client knows the how. I'm going to do that. So your job in helping your client and your job to facilitate the how I'm going to do this is to help your client refine it. Not to change it or alter it, but to allow your client to. MI is really in my opinion, often has to do with critical thinking that can impact my emotions, can impact my behavior, and can impact my meaning making. So there has to be this critical thought process once you get to this place of planning on why that model, and it is a model. You're asking your client to create a model of change with a strategic model of change, and then to have them critically think through that process on what that means to change, why it's important, what are some of the other elements, how is it going to impact your well-being, how is that going to impact the folks in your close circle, blah, 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 all of those things. The planning needs to incorporate that. And that's one of the things that's left out much of the literature of MI, is really to think post-decision-making process. So I believe that the planning part of it incorporates that post-decision-making process. To really be able to sit with you, clinician, to hear my thoughts, my feelings, when I actually implement, when I do implement the goal, when my behavior kicks in and I do that. What are some of the implications and consequences of that decision that it has on me and other? So that's kind of my version of that. I can hear myself going too long. I'm just going to go through this. I've got literature, but I'm just going to go through these kind of quickly because I really want to get to this this other place that I can provide you, especially when your client is in this ambivalent place and they've come to this place where they actually have a goal and what it means for them to process post-decision making from the model that I've designed. But I want you to understand the spirit of MI, that existential spirit, that meaning of MI, it's a partnership. It's done, I really like this quote, it's done with someone in a relationship versus being done to someone. So it is a process. It is about the relationship. It's not your role to argue with your client why that's a bad idea. MI believes that the client has the answer. That's the client-centered side of MI. The spirit of MI incorporates acceptance. And this acceptance isn't so much that you, clinician, accept client, because it's really about it's not even about you or me as a clinician. It's about the world out there. But it begins first, this acceptance. Can I find a place where I can accept me? This authentic me. That's part of this process of MI. It's strength-based model. We covered that several times. It's not focusing on the negative side of things. Ambivalence is human. Now, this accurate empathy, they call accurate empathy, it's conveyed through reflections on what you're observing from a strength-based perspective. It's showing your client that you're with them, that you hear them, and that you see them. I mean, these are some of the things that we can cover. I'm going to go through this. The other part of this, I think, is really important. What MI does too, it creates this process where you begin to, because the funnel is this big, and you facilitate a process where it gets much more narrow, it provides a client and validates for the client that you're starting to really begin to recognize their needs. And you're in that process and helping facilitate a process where they can actually design a model where they actually are able to meet a specific need that will impact. Go ahead.
Tiffany has a question about if MI would be a good process to use for clients struggling with depression, particularly COVID depression.
Yeah, that's COVID is such a strange phenomenon, and I think the field right now has a lot of questions on the how-tos because people are social beings. What's happening with COVID is that it's been taken. It feels like it for many of us that it's been taken away, this interaction need that we have, and so I can speak for myself on that. On how I process that. Family is really important to me, but there are some out there that don't have family. So my recommendation on depression is really be able to facilitate a process where your client can speak to what's missing. What are the things that you used to do that you really enjoyed? What are some of the ways that you kind of had that interaction need met? And so then for me, what I would do is I would look at different ways there, especially with the online stuff, the available stuff right now, because everything is online. And that's kind of the limitations of working with someone who is experiencing depression because of COVID. The limitations that we have as clinicians to really provide them access to something that's beneficial is going to be a challenge. So for me, I would look at really what did they enjoy before COVID? What are some of the things as you think about it might help in considering what's available online? Are you interested in getting resources? I mean, these are some questions. You get permission to kind of go to the place where you might be able to offer suggestions. But now, COVID depression, there's a couple of questions I have about my response. Is the depression pre-COVID? Was a client experiencing depression pre-COVID? Is it diagnosable? Or is it COVID that has really created the depressed-like state? And so activity is important. Humans need to move. They need to be active. They need to engage. There are certain elements of being human. We need engagement. We need activity. We need a sense of accomplishment. I need to be successful. So what are some of those ways? I mean, for some, it might be you move to that wellness model. What are some of the things you do for self-care? And that's really getting your client to really get up and do something. It's a really a behavioral approach on doing with the limitations that we have. And so some like to write, some poetry or whatever, some like art, some like music. So you have to find out from your client what is doable and what is it they can get up and find that might bring them a sense of well-being and accomplishment. I believe that self-esteem comes from accomplishment and failure. They integrate into my self-esteem when I can move forward. So the client really does, you'll have to really do a process work. One, to determine if the depression is pre-COVID. If it is, that's a different approach. If it's due to the COVID experience, what that means to me is the client was proactive enough to say that out loud. So it's very likely there are some elements of what that human can do to kind of remedy some of that staleness, if you will.
Tiffany writes that she has taken those small behavioral changes, those small steps has been the approach she's working with. But it sounds like this really ties into those three factors: the values, the importance, and the confidence.
Yes.
And if you could figure out from that process perspective, then MI would be a useful approach to help that client discover what they want to change and how they could go about it, find their motivation.
That's really well said, which I didn't think of. That's really excellent, Marcy. I mean, going back to kind of the previous part of the discussion is excellent, because those are really important key elements of just being human, let alone the concept of change. I
Thank
hope
you.
that helped a little bit, Tiffany. I think Marcy kind of nailed it there with a better response. So thank you, Marcy. I really do. That was an excellent response, and it helped me. So thank you. Yeah. Okay, if you don't mind, I'm going to scroll through these. I've got them on the PowerPoint. I'll post it. And there's some literature that you can find with all of these, because some of it's a little bit redundant. But I think number 2 is really the most key factor. It's not external. It is a very internal process. And when you go to values and you go to those other areas that we just talked about, those are really internalized efforts of a human being to find meaning. Somewhat redundant. Okay, assumption. Motivation is a temporary state. It's not a trait. You're not born with motivation. Sorry. It's a process. Resistance is not a force to be overcome. Resistance is normal, especially when it comes to change. That's why when I talk about really being able to refine the goal, the resistance goes away when I actually can identify what I want. Because then it moves me to a motivated place to really develop the strategies that I need to change. Ambivalence is good. What that means is your client is really processing the benefits and the risks of change, which is normal. Change does that. MI believes that recovery and change growth are intrinsic. I agree with that, because every day change occurs. And in the world that we live in now, especially politically, change is part of the human experience, and some people are suffering from it. Pandemics create change, and some people are suffering from it. However, recovery is part of the intrinsic part of being human. So remember that. You go into this MI model believing that recovery is part of the human experience, that's the truth. I'll send you the article that has all of these principles. Some of them are redundant. This is another model. When we talk about change talk, there's desire. I want to change. That's when they get past that pre-contemplation stage. I can change. I should change. I'm not sure I like that one. I should change because the final one is defining that need. I've identified my need. I have to change. And then the commitment, I'm going to change. That's some of the places when you look at this particular model, this is part of your facilitation process. This is that linear process where you can actually incorporate interventions that align with this particular model in an MI process to help your client get to these places. These are all of the, I got another nice article that'll cover all of those. Some of you have been exposed to this, but I'm going to kind of somewhat redundant. Okay, I'm going to move into this model just because I want to take a little time to do this. And I call it an informed decision-making model, or IDM. It's really establishing a goal. And that means the funnel is narrowed. You've come to a place where I know my need and my goal is to do X, to change something to meet my need. It's important that your client understands what success looks like. What is success? How am I going to know if I'm successful if I don't know what it is? It's certainly important to measure the confidence level on the motivation. Confidence and motivation are interchangeable. How motivated am I to make that change? You can process a goal with that 4D model, and I'll show you a brief example of how that's done. You can utilize that 4D model to establish meaning of that change and the consequences on what that means to change. Okay, I'm gonna exit out of this and go briefly to a different screen that I have on showing you what this looks like. Okay, this is my integrating kind of the 4 domains of the human process. Of course, those are the 4 domains. And understand that part of the assumptions of this model that counseling is intentional. Counseling, everything you do is an intervention. So move in that counseling ecology with intentionality. Everything, how you dress, your voice, the office, all of that, all of those are interventions. Human, we talked about that already, the multidimensionality of being human. We certainly have multiple identities. All of that affects how people change. I talked about enhancing the therapeutic alliance. If we begin to understand our client's process, on what domain they're actually processing their processing the process, we talked all about that a little bit. But this is kind of an informed decision-making model is really simply the goal is established. I know what I want. I know what I need. And so you actually develop this very dichotomous model. The interventions begin with, what are some of the benefits of moving towards your goal? And so you have your client list them. And so in that identifying those goals, you can process those goals. The second part of this is moving away from your goal. I worked this, and I shared this with some of you. I worked this with one of our, at the time, NCU student who came in tears, brilliant young woman. She came in, she was failing. And this is the first time I used this model. I asked her, I said, can I kind of use a model that I'm developing that we can kind of go through this process to find out what's happening? She said, sure. And I said, then we processed that some, and her goal was to graduate and get her degree. That was her goal. So we talked about moving towards that goal. She had some standardized responses to that. And then we went to the moving away from the goal. Remember, this is not a good or bad. Moving away from your goal is not a bad thing. Moving towards your goal is not necessarily a good thing. So when you get to that place where your client has identified at least 3 areas on both sides of this dichotomous model, you ask your client, what really stands out to you about moving away from your goal or moving towards your goal? And so your client's going to say something. This is where those brief interventions, what else? Because they're going to give you, you're asking him or her to kind of take those layers off to process what she's observing based on her own moving towards or away from her goal. And then the interventions look something like, so why do you think, what part of this process really stands out to you? And what do you think that means? Go to that existential place when you process these 2 areas. And then once they move towards that and they decide what really stands out to them, you may find that the goal isn't, like for the young woman, she found as she was failing, her degree was music. And when she got into that moving away from it, she goes, this isn't my goal. This is my parents' goal. I hate music. I like playing instruments, but I hate the classes. I want to be in psychology. And about a month later, she came back into my office and she literally had changed her degree and she was really in a whole different place. So moving away from a goal can have its benefits. So once they determine whether they want to move away from or if they want to move towards their goal, how confident are they are. It goes back to that defining success. So here's some of the areas on a post-decision making process that I'm still working through. These are pretty rough, but I kind of like this process. Once the decision made, remember this is a post-decision making process. And if you look at a cognitive perspective, what are some of the thoughts going through your mind about your decision? That's an important question. I've made a decision now. What are the thoughts going through my mind? It seems most easy to begin with that cognitive process. Now, because decisions have consequences, not just to me, but also to other, who comes to mind that will be impacted by your decision? That brings out the cultural elements. That brings out the values. That brings out all those internal areas of process that makes me who I am. So now you want to, in this model, you want to always move to the proactive, not to the negative. So who's going to be impacted? That may take you some time to process through that on how am I going to navigate that if somebody resists it or somebody's against it. So you go, these are just kind of the processes, but it's not the process, if you will. So who will support you making this decision? So you want them to really form allies, if possible, with someone who will support them. Now, the emotive side of it, how will your decision affect you emotionally? What's going on for you right now as you've gone through this whole process? What's going on in here right now? So what emotions did you experience going through the process? What was that like for you? Are those emotions different now that you've made your decision than when you were going through the process? How will your decision affect those closest to you? The behavior, if you follow through with your decision, what needs to happen? This is a strategic planning phase of what happens post-decision. So what's your timeline to implement this? Is there anyone else that you would like to discuss your decision with before you actually implement your decision? Especially for those folks that are more collective, they may have to talk to an elder or to an uncle or an auntie or somebody outside of their folks or whoever is resisting. So you give them an opportunity to kind of live within the scope of their culture if necessary. So that's why I integrated that one, because there are folks who will need to really kind of get permission to really be able to move forward or to get buy-in from one of the elders or somebody in the family of importance that's important to the individual. So what do you need to do after you implement your decision? I'm asking them to consider what else. That's a long version of what else. But this is post-decision making. What do you need to do after you implement the decision? What are some of the areas of concern? What are some of the things that have brought you to that place where you feel strong about your decision? What needs to happen? And then finally, the existential, what would it mean if you implemented your decision after you leave here? What you want to do is you want your client to implement that plan sooner than later. That's more your directive intervention on getting your client to commit. And of course, some of you recognize this intervention. What did you learn? So that's a real brief look at kind of this model that I'm attempting to kind of work through. I think it's important to read, and this will probably change. And if you integrate this into your own process post-decision, when a client has identified the need, they develop the strategy to implement a process where they meet that need, and then talk about post-decision on what that means for them, so they can actually think through some of the consequences. Some of the consequences are very proactive. Consequences aren't always bad. So it's not a negative approach, although there will be some negative elements to that. Once you get to this place where you can go through this process, again, stay within the context of a strength-based approach. Validating values, the importance of their decision, the meaning of what it means to be able to implement that change. And so that's kind of what I have. Went through some of it, but I've got lots of articles. I'll ask Ryan if I can post them in the model, the CMHC program deal. So I don't know, that's it. That's kind of a brief look at MI. Covered some of it, certainly not comprehensive, but kind of an overview of what it is.
Absolutely. Thank you so much, Jean. That was wonderful. Michaela was wondering if you could email her this presentation and she could put it up on our Facebook page so that people could see it also, because that's just a fantastic look, both the survey of MI as well as your model. That's really fun.
And then we can, once Ryan, I mean, I don't see any reason why he would say no, but I'll put some of the more comprehensive looks at MI. Certainly the textbook itself is awesome and way more comprehensive than what we did tonight. So there are some resources out there. There's certainly, go to Avon in the library. They have some great videos of MI that'll give you a much more comprehensive look at the process. But remember, it is a process. And that's where healing occurs. I guess that's what I would finally say. Okay. That's it.
Perfect. Thank you so much. Wonderful.
All right. Thank you guys for listening.
Absolutely.
Thank you, Dr. James.
Thank you.
Thank you.
Thank you. Have a great night.
We're so happy to work with you.
Thank you.
Good to see
And
some
maybe
faces
this
that
week we
have
will.
moved on.